I'm happy to be here with you all to talk a little bit about long-term care and home and community-based services Medicaid. So as was said, my name is Corrie. I work for Benefits in Action, and I help do some applications for public assistance, and I supervise some folks that do that as well. So one of those that we see a lot, especially in folks that are a little bit older, but also in children, is long-term care and home and community-based services. So I'm excited to tell you first a little bit about Benefits in Action, and then get into the nitty-gritty things about those benefits. And like was said, please raise your hand if you would like to ask a question at any point. And if we're about to get to that topic, I'm happy to wait a second. Otherwise, we should just answer it right then and there. So we serve people across, but we can help anyone across the entire state of Colorado. So we will go over that. We'll go over some programs and projects, and then next steps once you know that this is a benefit that you are interested in. So we are a nonprofit organization dedicated to supporting our diverse community with focus on the elderly and underserved to improve understanding, access, and utilization of food and health-related benefits, with the goal of enhancing food security, health, and well-being. So we really help with any public benefit or anything else that's available through the county, the state, or the federal government in Colorado. We are a HIPAA compliant organization, so all of our staff must attend and pass HIPAA training annually and conform to the HIPAA rules and regulations. We do handle a lot of protected health information, and so that's just a good thing to put out there. Okay, so what do? We do three main things as a part of our navigation sector in Benefits in Action. So we help with application assistance, navigation, and education. Application assistance would be referring to specifically helping someone complete and submit an application for a benefit. Navigation might be before you get to that application for a benefit, understanding what you might qualify for and how to go about applying for that benefit. It might also be, oh, my light just turned off. Let's see if I can, yeah, this will be all right for now. It also is after the application assistance has happened, right? So after we submit that application, the steps past that, when an application goes to another entity and is processed, we can help somewhat with navigating that. With education as well. So not only do we talk and screen people for these benefits, but we want to make sure that folks know what is out there and what they might qualify for. So that is connected to benefit literacy, understanding, and utilization. So we want to make sure that people know that they can qualify for something once they're on that benefit, that they know how to use it, and that we all have a good understanding of that. Go to the next slide here. So in terms of education, we do a lot of community presentations. A lot of our education is actually individual, so one navigator and one client, about what benefits exist, what they might qualify for, and how they can use benefits that they're already on. So that is a big part of what we do, both in person and over the phone. So if someone doesn't live in one of those places that I described as us having a physical presence in, we can always talk over the phone. And that's something that we've gotten really good at doing, especially since the pandemic. So if there isn't a way to meet in person, if someone lives on the Western Slope, for example, that is always an option, although we can definitely try to make it there in person if needed. We also have some Medicare 101 presentations, and that was just mentioned earlier. I think we've got one of those coming up for you all in early September. So Medicare is a benefit for people who are either on disability for 2 years or who are 65 and over. in the US. And so there are some differences with those benefits, differences from commercial insurance that someone may have been on before, and differences from Medicaid or some other type of state health insurance. So it's good to know about that. There are also different monetary penalties that may occur if someone does not enroll within the allotted time frame. And so that's really important that people are aware of that and that we can share that information. We do presentations about Connect for Health as well. Connect for Health is also called the Marketplace in Colorado. Connect for Health is its specific Colorado name as well. And that is a group of insurance plans that have an income limit, but that income limit is much higher than the income limit for Medicaid. And so that could be useful for people that have no insurance because they're self-employed, but are not under the income limit for a benefit like Medicaid. It could also be useful for people who are experiencing a lapse in coverage or something else like that. So we always like to mention that. We also have presentations about the use of SNAP. So how we can best make sure that you get benefits. And SNAP is an acronym that stands for Supplemental Nutrition Assistance Program. That was formerly known as food stamps. And so we talk about, how you can get those benefits, how many you might get, what sort of expenses that are typically counted towards your allotted amount awarded, where you can buy food with that amount, and other related programs. And then lastly, we do community presentations to organizations like you. So if there is a specific group of folks out there that have a common interest and we can help them in their area by providing education about any of these benefits, we're more than happy to do so. So thanks again for having us. All right, so this is a little more full view of the programs that we can help with. In terms of health benefits, we talked a little bit about Medicaid. So that is an income, a benefit that has an income limit for health. We're going to talk a lot about Medicaid waivers, which are also benefits that have income limits, but they also have some other stipulations. We'll get into that a bit later. Then we've got a couple types of cash assistance programs that people might be eligible for if they fall into certain categories. And then along with Medicare, which we can help people enroll in, we also have a ship navigating team, and they are certified health insurance navigators that are unbiased, unpaid, they're volunteers, and they can help folks choose what types of plans in their geographic area and with their specific diagnoses and medications might be available, right? So they give them some options for what covers certain medications, and then the individual can then say, oh, I would like this one, and get help enrolling in that. In addition to both of those things, there is something called the Medicare Savings Program, which is a supplement to Medicare for people under a certain income limit. So if you have a loved one or someone that you're caring for that is eligible for home and community-based services or long-term care, they may also be eligible for the Medicare Savings Program. Not always, but oftentimes those can be linked. We talked a little bit about Connect for Health as well, and then Social Security. So Social Security retirement can be taken starting at age 62 at kind of a lower amount for the rest of your life. Then right now, it can also be taken at age 65 for what people typically call normal retirement age. And then it can be taken at age 67. And by waiting a little bit longer, they give a little bit more money each month for the rest of that individual's life. So we've got Social Security retirement, and then we also have Social Security disability. and supplemental security income. So if someone is under the age of 62 and they have worked in the US and lived in the US, either as a legal permanent resident for more than 5 years or as a US citizen, they can qualify for Social Security disability insurance if they have something like Parkinson's, or they can qualify for supplemental security income if their Social Security retirement or Social Security disability is either a very small amount, or if they don't have enough work history. So lots there, but we do help with Social Security navigation. SNAP, we talked about a little bit. If someone is qualifying for the Medicare Savings Program, they might also qualify for SNAP. If they're on home and community-based services in the home, they might qualify for SNAP as well. We do some food deliveries as well in Metro Denver area counties. And then over on the right-hand side, we have some financial assistance programs, including helping with the LEAP heating assistance, TANF, which is for families with children under age 18, CCAP, which is a child care assistance program benefit, and then a dental grant for folks 60 plus. So if you are on many types of Medicare and you're not on an Advantage plan, or you don't have a supplement of dental insurance, if you are over the age of 60 and live in the state of Colorado, we can likely screen you and approve you for dental care. So that's a great benefit that we're trying to spread the word about. RTD Live is a transportation benefit, and that's for anyone, even if they don't have disabilities, if you're under a certain income limit. We help with tax assistance and filing rebates. There was one this last year that helped a lot of folks. And then we have some mental wellness groups. So a music group, a caring connections group for caregivers, and then our connectedness program, which is kind of just something for people to talk to folks that began with the pandemic, with all of that isolation that we were experiencing. All right. So this is the first slide about long-term care and home and community-based services that I've got here. And so these are talked about together a lot. They are two different benefits in actuality, so the experience is quite different. So for long-term care, we have that for someone who is seeking to go into a long-term care facility or a nursing home. So that is going to be a place where you could expect to receive 24-hour care if needed, or around-the-clock care at the very least. Home and community-based services, on the other hand, is a similar benefit. However, that is for people seeking help in their home with activities of daily living. And so activities of daily living may include things like physical activities like getting out of bed, transferring from a chair to a walker or standing up, bathing, preparing meals, eating. And then it might also be some different tasks like scheduling appointments, managing medications, managing financial things. So all of those kind of daily tasks that we think of in life are defined as activities of daily living for eligibility purposes of these benefits. Home and community-based services allows you to get help in the home from a caregiver. It also supports someone seeking to move into an assisted living facility. So an assisted living facility does not have 24-hour care available. However, there is some care available. And so that can also be covered by the home and community-based services waiver. And that is really helpful a lot of the time if someone is having a hard time paying rent, if they need to move out of a house because it doesn't suit their physical needs or some other reason, right? So the frequency of help from a caregiver in both the home and in an assisted living facility is going to be dependent on a medical and functional evaluation. Right. Okay, and I see a question or a comment in the chat that I'll go ahead and address from Russ. It says, I've tried to get long-term care insurance, but the insurers I've talked to said because I have PD that I can't get covered. I am not quite as familiar with private long-term care insurance policies. Those definitely exist out there. And they may have something to do with pre-existing conditions. It's good to have that if you need it. You'll also see coming up in some slides that it might help protect some financial resources of yours. But unfortunately, I can't speak much to those private healthcare policies for long-term care. In terms of these state policies for long-term care and home and community-based services, that would not be a reason for them to deny you. And actually, because it's from the state, it would be something that is pretty much given to you. Yep. Yeah, and then Maeve says age when you apply is also a factor for long-term care coverage. So yeah, that could be the case for private insurance as well. For public assistance through long-term care or home and community-based services, you have to present a couple pieces of eligibility. So age is one of those factors, but I'll go ahead and go on to the next slide. I think it has some more details about that. Right, if I can. Okay, yeah, so here are some benefit requirements. So for both long-term care and home and community-based services, the client must meet the requirements for a certain level of care and complete an assessment with their county's single entry point organization. So requirements for level of care needed are going to be mostly substantiated through evaluating activities of daily living, as well as medical diagnostic, right? So if someone has Parkinson's disease and it doesn't need help with anything that they're doing daily, they probably won't be able to qualify for this benefit. Or at least, you know, if it's not difficult for them to do, right? If they do need help, or if that would make their life significantly easier because it takes a long time to complete those tasks, that might qualify and meet the requirements for a certain level of care. So that would be step one. Completing an assessment with their county's single entry point organization is actually a step that goes towards the end of the application process. So the single entry point is the organization that will actually evaluate the individual and see if they meet the requirements for the level of care. So oftentimes that's over the phone, just asking them what types of tasks that they need help with. It can also be in person sometimes. Yeah, so second point of requirement is that the client must be a US citizen or permanent resident for at least 5 years. Yeah, we talked about that a little bit with some other public benefits. There are a few public benefits out there that do not require permanent residency of at least 5 years or US citizenship. However, for the most part, they do require those two things. So for this one, we'll talk about that as an assumed requirement. The third one is that the client must live in the state of Colorado. So this waiver benefit is through Colorado State Medicaid. Many states have similar programs. However, states are able to design and administrate their own Medicaid programs. And so it will likely look different from each state, or at least there is difference from state to state. For the client must meet the financial requirements, and we'll take a look a little bit more on what those financial requirements are. And then the last one here is that a client must sign a Medicaid real estate recovery waiver. So we will also have a slide on that and go into a little bit more detail. And that is one reason why people might try to stay away from this benefit. So we'll get there in a second. All right, so eligibility for both long-term care and home and community-based services includes both financial and health status components. So we talked a bit about the health status component, that level of care and a diagnosis of something substantial. So Parkinson's, yes, you would get there with that diagnosis, and then it would just be a question of what level of care is this person needing at this point for their activities of daily living. For financial eligibility, we do have two parts. We've got an income limit and then a resource limit. Resource also kind of means assets, right? So for the income limit, our income limit for the applicant for 2023 is $2,742 before taxes or any Medicare deductions. So that would include Social Security of any type, any other income from any self-employment, any current employment, pensions, things like that. And that amount does get changed each year. So, and it's not always the same as the Social Security retirement account, or retirement amount might be changed, right? So it's worth, if you don't qualify a certain year, it's worth seeing if you might qualify based on that income limit the next year. There is a resource limit, and so that's how much money you can have. Basically, resources are defined as stocks, bonds, untapped pensions, checking accounts, savings accounts, cash surrender of life insurance policies, etc. So really anything that could be liquidated, and any liquid cash counts towards that resource limit. So that's pretty low, $2,000 for an applicant. If there is a married couple and one of them needs these services, but the other one does not, the community spouse, meaning the one that does not need these services, does have a resource limit of $130,380. I'm sorry, $130,380 in their name. So that's quite a bit more, so that you can still, live a life as that community spouse or someone that's not receiving this benefit. If both spouses are applying, so if both of them need either care in the home or to move to an assisted living or 24-hour care, the combined resource limit is $3,000, so it's lower as well. Yeah, looks like Alice has a question. And let's see, I think I can unmute her?
Alice, we are asking you to unmute, so I would click the little microphone. There you go.
So,
yeah, we're talking monthly income, right?
Yes, thank you for that clarification. This is monthly. Yep.
Okay, thank you.
Yeah.
And the resources, what is the 2,000? What's the time on that?
Yeah, so that is at any, so that would be like at one point during the month. So you could go over that as long as you come back down and your average sits at $2,000 for the month. So, and they evaluate things on a 30-day basis for that. They're not going to monitor really, really closely every single day of the month, but just in general, that's got to be the average balance in any of those financial accounts.
But thank you.
Yeah.
Yep.
Okay. Oops, didn't mean to go back there. Okay. And so we talked about, if there's a community spouse, they have a much higher ceiling of resources. So there's a year of time after someone goes on to these benefits that they give you as a grace period to have joint accounts with money in them together. And then after that year, they say, okay, you need to have all of your money in your own name, even if you're married, as the community spouse, so that we can make sure that, they are at their limit and you are at your limit. So that is kind of how that works functionally. For the benefit, for the person themselves, one vehicle and one home are allowed. So if you're a married couple and you have more than one vehicle, that's okay. But they just want to know that, either there's one vehicle per person, or, the average is that person has one vehicle. And only one home is allowed. So if there is more than one real estate property owned, that would make one ineligible, at least until that second property is sold or something like that. It is important that all income and resources are fully disclosed, just to make the process go more quickly. You don't want to wait a really long time for this determination and kind of count on it and plan for it, and then realized, oh, I forgot to tell them about my summer home, and then get denied. So that's, we want those answers to come more quickly for you and to help you plan a little bit better. If you do not meet the income requirements, you may be eligible through a couple different options. So if you don't meet the income requirements, not everything is lost. There are two ways around this. The first way is that you may be eligible through the Health First Colorado buy-in program for working adults with disabilities. And this is a link to a website with information on it through the Healthcare Department of Policy and Financing, HCBS. Basically what this is this says that if you are working, or if you can report some type of earned income on a monthly basis, anywhere from actually working somewhere for an hour a month, or 40 hours a week, right, to taking your neighbor's mail in, or helping them sweep their kitchen, or something like that, right? So some task that you could report that you are doing in exchange for money can count as working. And that would allow you to buy in to long-term care or home and community-based services. And what a buy-in means is that instead of them just saying, no, you don't qualify for this at all, you get the opportunity to show that you are doing a task like work, and then pay a premium each month in order to receive the same benefits as someone under the income limit would be receiving. And those premiums are based on your income level, right? So if you are just over the income limit, it'll probably be $30 a month. The next tier is about $60 a month, next one $90, and so on. So oftentimes that's still going to be a much better deal than paying out of pocket for long-term care or home and community-based services. So that's one option. If you or a loved one are not able to claim some type of work, if you're either not working or it's just really impossible that this person would do anything like that, there is something called a Miller Trust. And let me just go ahead and get this out of here. So it's also called a Medicaid Income Trust. And what that is a trust that you set up with the state of Colorado. And you do have to get that set up before your long-term care or home and community-based services is approved. But what it does is it takes the difference between the income limit and the actual income that that individual is receiving and puts it in a trust for the state of Colorado to use, basically to pay for your care. So if it isn't an option to do the buy-in, there is the option of a Miller Trust, which kind of takes off your top layer of income, gives that to the state of Colorado, but still allows you to be on those Medicaid benefits. And then sorry, I'm going to catch up here with questions. Can you talk specifically about life insurance policies? So yes, life insurance policies, usually there are about two types. One of those has cash value when you are alive. And so let's say I had a life insurance policy with cash value of $10,000 while I'm alive. That counts towards my resource or asset limit because I would have the potential to cash that out at $10,000. I'm probably insured for a lot more than that if the cash out value is $10,000, but that still does count towards my limit. If it's one of those life insurance policies, and these are called revocable and irrevocable, if it's one of those that has no cash value while I'm alive, then that is fine. I can have as many of those as I want. It's just the ones with cash value while the insured person is alive that count towards that resource and asset limit. Resources, yes, I kind of answered that. Resources do include real estate. And right, so one home, they don't count against you. But there are some more details about that one home that we will get into here in just a second. So we'll go on to the next slide. All right. And then so we talked about what to do if you don't meet the income requirements. If you do not meet the asset requirements, you need to spend down. So for example, if you had a cash value life insurance policy, you would probably cash out on that, unless it's under $2,000 and you don't have any other cash, right? You would cash out on that and then you could spend down that money. Let's say you have stocks, bonds, retirement account, anything like that, you would probably do the same thing. And some good ways to spend down that money for yourself include paying out of pocket for care at home or at a facility, whichever one is needed, or by purchasing needed medical supplies, getting home modifications done, comfortable clothing, shoes, maybe a new bed, anything that's going to make your life better, right? Because this is your money, so you might as well invest it in yourself. However, what you cannot do with that money and call it spend down is giving away large sums of money, or purchasing more than one vehicle or real estate property per person. So those are some of those situations. Again, we talked a little bit about the community spouse and the spouse receiving the benefit. So you want to be careful there. The community spouse can have up to $130-something thousand. So you don't need to spend down your spouse receiving the benefit. If you're on joint accounts, you don't need to get rid of all that money as long as it doesn't go over that limit for the community spouse when you transfer over resources. Okay, so we will go to the next page here. And I guess I'll add one more thing on that last slide. It is good to keep track of your expenditures. So if you are doing that through a credit card, it's really easy to check those credit card statements. So you might not have to do much bookkeeping at all. If you are mostly writing checks or paying in cash, you would likely want to keep some type of a handwritten or typed record just on what you are using those funds for, so that you've got proof, no, I didn't give it all away to my grandchildren. I used it on these things. So the community spouse can have one vehicle and one house, correct? Now, and that would be if the individual is in long-term care. If someone's in long-term care, they're probably not going to be driving, and they're probably, they're in a nursing facility, so they're not going to be living in another house, meaning that community spouse can have a vehicle and a house. If the client receiving the benefits is still living in the home, then obviously together you would only be allowed one home and then one vehicle each. So that's a little bit different, but basically the same numbers. All right. So the Medicaid real estate recovery waiver. This is a big one for folks. I like to warn people about it and sometimes bring it up sooner than later in the process, just so that people know about it, and if they have any other options, can weigh them, right? So what is the Medicaid real estate recovery waiver? I'm going to see if I can open this link. If not, I can just tell you about it here. Yeah. So this is bringing up, can you all see that all right? I hope you can.
I only see the presentation. You may have to change your screen.
Okay, sounds good. Let me do a new share here. Perfect, thank you.
You're welcome.
And what about now?
Yep.
Okay, awesome. So this is from the state of Colorado as well. It's just a good informational page. So I figured I'd put it up here so that it was part of the presentation and we could read over it. So medical, yeah, Medicaid has this Medicaid real estate recovery waiver. What is estate recovery? It is a program to help pay costs of providing services to people on Medicaid. It's required by federal law. So this is something that every state has to implement, regardless of what, what we as voters would like or what the state itself would like. They have to implement that. Anyone who receives Medicaid with these specific circumstances might be affected. So, and the circumstances they're talking about are the ones listed below. So medical assistance provided on behalf of an individual who is institutionalized or who receives nursing facility care, home and community-based services, related hospital and prescription drug services. So those are the two that we care about. What that means is that their recovery, okay, so for recipients age 55 and older at the time they receive medical assistance, the costs that are able to be recovered are limited to those things. But basically what it means is that they can file a claim against the estate of the deceased Medicaid recipient. The estate of the recipient will include all of the property, personal and real. So we've already got really low assets for this person once they get onto home and community-based services or long-term care, right? But the real estate property is what we haven't really talked about yet. So if there is real estate property left when the recipient passes away, then proceeds from the sale of the property in the estate will be used to reimburse the department for medical assistance provided on behalf of the recipient. So if there is a community spouse still living in that home, or if there is someone else like a caregiver or a dependent who would be otherwise without a home, or dependent on public benefits themselves if they did not have this home, that Medicaid real estate recovery waiver, they don't take that home from you, right? But if you're a single person, or if you have sons and daughters that are helping take care of you, but they live in their own homes, signing this Medicaid real estate recovery waiver that would allow you to receive home, community-based services, and long-term care does mean that the state would be able to sell that real estate property and recoup some of their financial expenditures on your care through that sale. So that's important to know. It shouldn't be a worry if you have, like I said, a community spouse or someone else that would need to live in that home. However, it does affect what is able to be left to any recipients of your estate. Okay, so now I'm going to go ahead and share the presentation again here, and we'll go back to that page. Okay, all right, so we went over that first part there. And yeah, so we described this about the lien placed against the home. It's not acted upon in those circumstances, a spouse or someone else. If a reverse mortgage is at play, then the client no longer owns the home. So that's also important for anyone in that financial circumstance. Yeah, so that one's a little bit different. So if there are any questions, I'll go on to the next slide here. Right. And if you ever want to come back to that throughout this presentation, feel free. We've got about 20 minutes left here. So for long-term care and home and community-based services and assisted living, there are some differences in the financial implications of that. So we've already described the difference in care, and that long-term care is available care 24 hours. Home and community-based services is in your own home. It's not 24-hour available care. It's at certain scheduled hours with the caregiver. Assisted living, it's in an assisted living facility, but similarly, you would have certain hours of care that would probably be regular and scheduled. So monetarily, the differences are that for long-term care, the applicant's income is diverted to pay the facility fee, and the state of Colorado pays the rest of it. So if, let's say I get $1,600 through my Social Security, every month and I'm in long-term care, what will happen is that the state gets all of my income from Social Security, except I get to keep $91.35 a month for my personal needs allowance. So if I'm in long-term care, I don't have a rent bill, I don't have utilities, don't have a mortgage, I don't have a care bill or a food bill. So that personal needs allowance would be for things like toiletries, other things that come up in life that we have to pay for. Often people ask, my spouse and I share income, we pool income. What happens if they are the higher earner in either their pension or Social Security, right? There are specific stipulations that you can find online and different calculations that they use in order to help the community spouse keep a small portion of that income, of their spouse's income, if this is the situation. So don't lose hope there. It's not that you would be left with just your pension or Social Security, but you wouldn't be able to keep both incomes. And then for HCBS, for home and community-based services, there are only a certain number of hours of care that are approved for that person based on the single entry points evaluation of the level of care. So if they say, for example, that you get 16 hours of care a week, you're not going to be able to get more hours of care until you have a new application, or I'm sorry, a new evaluation. And they determine that, actually your state has worsened, or for this reason, we understand that you need more hours of care. And then you would be able to increase those. Of course, you can likely get more care than that through a different provider, different third-party provider, or by paying the specific agency that you're working for or working with out of pocket. But those just wouldn't be reimbursed by the state until a new evaluation has been done. So then in assisted living, one advantage to that is that the rent is free, or that mortgage is free. You don't have a cost to live there. And also no income is diverted to pay for your care. However, there are still only a certain number of hours of care. So just like home and community-based services, if you got approved for 16 hours of care a week and you are needing more, you have to go back to the single entry point and say, hey, this is not enough. My situation has worsened. Can you evaluate me again? And that would be how you could get more care to be paid for. So that's that difference. Okay, so we'll talk a little bit about the application process. So we've talked about how long-term care and home and community-based services are state benefits. So all of this information has been about the state of Colorado. And so in the state of Colorado, we also have county-controlled public benefits for the most part. So that means if I live in Denver County is the county that's going to be processing my application for medical assistance or cash assistance or food assistance, not El Paso County, right? So it's locally controlled by the counties. So the application process starts by first seeing that you meet these eligibility requirements that we talked about, and getting an application together and all of that. Now you can search for help doing that through the help of a caseworker if you're already working with one, or a social worker, or with the help of our benefit navigators. We submit these applications all the time, no cost. You could also do it on your own. If you feel like it's pretty straightforward, you can do that too. There is a website online called Colorado Peak. And if you've been on public benefits, you likely know about that website. You can request these benefits on that website. There are also paper applications that you can fill out and submit to your county, either by dropping them off or faxing them or mailing them. We tend to see higher success rates when someone else is reviewing the application before it's sent off by the client, or maybe, whoever's helping them that hasn't done this before. And so if you have any questions about that, we're always here to help with that. Once the application is submitted, the specific county that you submitted it to has up to 90 days to process the application. So that's about 3 months, right? So that's quite a long amount of time from your financial determination and your medical determination being approved to actually them saying, yes, you now are enrolled in long-term care Medicaid or home and community-based services Medicaid waiver. While the application is pending, a client can move into a Medicaid pending bed. So, that is one advantage, right? So 90 days is a long time between when someone who maybe has a very sudden injury or very sudden progression of symptoms is able to have an application submitted on their behalf, and then when they might actually move into that bed. So for that reason, long-term care facilities that accept Medicaid allow clients to move into a Medicaid pending bed. It's called, as long as they have proof of that application being submitted. And then what happens is once you get approved for long-term care Medicaid, you know, if they take that whole 90 days to process it, or if they just take 30 days, then they will backdate that coverage to the date of application. So if I needed to move into long-term care tomorrow and someone submitted an application for me today, 3 months later, once they approve me, all of my services starting tomorrow should be paid for by the state. Yeah, so for long-term care specifically, that might also mean that you don't want to be spending your income, right? Because they're going to come back and say, well, we need all of your income except $91 and some cents for those months that we're paying for your long-term care. So if you have anyone in a Medicaid pending bed, just make sure, you know, keep their income so that the state can come get that and you don't have to find the money somewhere. All right, so for home and community-based services, we talked about caregivers, and also that, you know, a caregiver has to accept Medicaid, and the county caseworker can help you find a care agency that does accept Medicaid. Caregivers have been a little bit short-staffed in the past couple of years because of the pandemic and things like that. They are out there. However, if a family member or friend has been performing help for your activities of daily living at home, this is for HCBS. And if they would like to continue doing so, or continue doing so at halftime and have a paid care provider do the other half, that is possible. And you can actually get paid minimum wage to do so. There is an organization called PASCO, which stands for Personal Assistance Services of Colorado, that assists with the Denver, Colorado Springs, and Fort Collins metropolitan areas that can help that friend, family member, someone else who has been caregiving get certified to do the specific caregiving activities that they have been doing or need to be doing in order to meet this client's requirements. And then once they get that certification, they can get paid for those services through HCBS. So what that means, that's tailored to the individual. If it's not like a CNA certification, it's not like a nursing degree. If my loved one needs help with, you know, giving themselves insulin, for example, then I would need to get training by a medical professional to make sure that I was doing that properly. And so that's kind of how that works. There are obviously some limits to what someone who does not have a medical certification can be doing for their loved one. And so that's really important to know. And of course, we want them to be receiving the correct and best care. But if it's these things that are done at home often anyway, then this is a great way to do that and to continue caring for your loved one. So I see a question from Russ: can Medicaid be used to pay for my monthly Medicare coverage? Yes. So let's see, I'm going to go all the way back here to the very beginning to highlight something there is a benefit called Medicare Savings Program. Right down, oops. Right here on the second bullet point under health, that Medicare Savings Program is income dependent. So you can only qualify if you are under a certain income limit. But if you do qualify, if you are under that certain income limit, then they can pay your Part B Medicare premium. And so that's actually got nothing to do with long-term care or home and community-based services. However, that is a benefit that's available to people on Medicare. There are a couple different tiers. So if you have a very low income, you might qualify for payment of your Part B premium. And you might also qualify for payment of some copays and deductibles through your Medicare. And then if you are on the higher income limit level, but still qualify for this benefit, it just pays for your Part B deductible. So hopefully that covers some of that question there. And then we've got another question following up on Russ. Does the person have to give up supplemental health Medigap coverage? No. So, sorry, we'll go back to this page. The home community-based services or long-term care waivers are additional. So they are on top of everything else. You still need to have Medicare, and it would still be nice to have something like the Medicare Savings Program to cover that expense if you already have it. However, it does cover everything that you don't already have covered for the most part. So if you already have a Medigap coverage plan, so maybe Medicare plus a supplement or Medicare Advantage or dual eligibility Medicare, Medicaid, there's no reason you need to get rid of that. In fact, the state would probably say, hey, thanks, we're glad that they're paying for that and not us, right? However, if you are paying a premium to keep your Medicare Advantage plan or to keep a Medigap coverage plan, you might reconsider that, right? Because you will be covered through these waivers if nothing else comes as a primary payer. So unless you're paying for it, no reason to get off of it. All right, so we'll go forward again now. And I think I'm almost done, and then we can see if we've got any more questions just in general. Okay, yeah, so questions. What can I clarify? And then also, what do you think individuals in your community need help with the most related to this benefit? If there are any questions or concerns you have specifically related to Parkinson's that I could answer or try to answer. And if we've answered them all, that's fine too. I'll give it a couple more seconds here. This is also our contact information. So these are our social media handles here: Facebook, Twitter, Instagram, LinkedIn. That's my email address. So if you have any questions, you could always email me directly. And then highlighted, we have our office front desk phone number and an information email address that you could always raise as well. And I see Alice raised her hand. So let's see here. I'm asking you to unmute. So hopefully you can do so now.
Over here.
Awesome.
Okay. The question is I would be the one receiving benefits, and my spouse actually owns the home. I do not own the home. If I died and then she dies, would her estate, her home go back to the state, or can she leave it to her grandkids?
Yeah, that's a great hypothetical question that I didn't cover. So if your name is not also on an asset like a real estate property, even if you functionally are sharing them, then that does not come into play with the state real estate recovery waiver if you're the one receiving the benefits. So in this situation, yes, she could leave it or they could leave it. It would be untouched by the state.
Okay, great. Thank you.
Thank you.
Yeah. We do also have, I'll highlight this in the bottom corner, and if anyone else has a question, you can raise your hand. This is our food delivery website. So if you know someone who is homebound or who is caregiving for someone that is homebound and they are unable to get their own groceries, we have a food delivery program for the counties of Denver, Arapahoe, Adams, Jefferson, and there might be one more. It's on our website. I should remember that last one. But if you know anyone that needs those services and if they're homebound for some reason, you can use that website and sign them up for a food box delivery. And we do that for folks. We started that as also a function of the pandemic for older families or people who were immunocompromised, also younger families that could go out because they had younger children. And I think that's still pretty viable of a thought for a lot of people that are in the home. So just leave that there. And yeah, thanks for the info. Russ says, of course, you're welcome. All right. Well, thank you all so much for listening. If there aren't any other questions, I will turn it back over to Par.
Were you able to answer Maria's question in the chat?
Oh, I'm sorry. I must have. At what, thank you for catching that. At what point does one switch from medical disability to regular SSI? Yeah, so I think I'll explain a couple things there, and I think it should answer your question. So if someone has been on Social Security disability and they are under the age of 62, then they've been receiving Social Security disability payments because they can't work, presumably, right? The point at which those Social Security disability payments switch to Social Security retirement payments or SSI, if they don't have enough work quarters, would be when they turn 62. That's the early retirement age. So the state basically says, okay, you have to switch now because you haven't been employed, and so we're rolling you over onto early retirement instead of Social Security disability. And so if you have 10 years of work history, at that point, you would start to receive your Social Security retirement benefits. If you don't have 10 years of work history for whatever reason, then you would get rolled over onto SSI benefits, and you would likely already be on those instead of Social Security disability without those work quarters. And so we talked a little bit with disability about Medicare. So after you've been on Social Security disability for 2 years, you would then receive Medicare health insurance. That can happen before you're 62 or 65. But if you were not on disability, Social Security disability, then the time that you receive Medicare is 65, the age of 65.